Hello students, welcome to Dr. B.R. Ambedkar Open University. I am P.V. Raju, working as a psychologist in an organization. I am also working as a resource person in this Dr. B.R. Ambedkar Open University. Today we will discuss the topic related to the psychology. The topic name is biological causal factors of maladaptive behavior. So, maladaptive behavior, adaptive behavior and maladaptive behavior. If you want to understand the maladaptive behavior, what is adaptive behavior? That we will understand. So, the adaptive behavior means the person having set up of that is adjustment capabilities. For example, if an individual is having capabilities of adjustment within the person, adjustment within the family, adjustment within the community, society. That is adjustment capabilities. If the person is having adjustable capabilities to the new environment, new situation, that means he is having some sort of adaptive behavior. It is a behavior that allows the individual to change an unconstructive behavior to more constructive. If the person is having adaptive behavior, if any situation, if any environment is not structured, if it is unstructured environment, due to his adaptive behavior, because of his adjustmental capabilities, he will be in a position or she will be in a position to convert, to change that unconstructive behavior to more constructive behavior. The situation may be new, the environment may be new, but he will or she will change that unconstructive behavior, unconstructive way of behaving to more constructive way. Adaptive behavior is a behavior that enables the individuals to cope in their environment and situation with greatest success and least conflict with other individuals. So he or she may be in a position to adjust with the new situation, new environment. If the constructive is not up to the mark, unconstructive environment, unconstructive behavior of any other individuals, these adaptive behavior, the person having adaptive behavior, even though the unstructured, unconstructive behavior may be changed to more constructive behavior because of their adaptive behavior. Then if the person is having adaptive behavior, the individual is in a position to cope up with the situation, to cope up with the new environment, new situation with the greatest success and least conflict with others. I will explain what is the conflict with others. Generally, the conflict may be on their opinions, the conflict may be their instruction, the conflict may be their decisions. For example, if the decision is maybe if they want to decide from two options, one option they want to opt from two options, maybe both options are favorable options. In the favorable options also, if the individual wants to choose one option from the both options, that is conflict management. In the conflict management also, they can manage their conflicts with other people, other individuals, or within their own self. The individuals, if they have adaptive behavior, they may be in a position to manage their conflict, solve their problems in the successful manner. The great success may be within these individuals because of their adaptive behavior. Now we will discuss the maladaptive behavior. What is maladaptive behavior? Maladaptive behavior is a type of behavior that is used to reduce one's anxiety, but result is non-productive. As I mentioned, adaptive behavior, they may be in a position to manage their new situation, new environment with great success. But whereas these people having maladaptive behavior, the people are more maladaptive behavior. That is the reason they can't succeed in their conflict management. They can't succeed in their systematic environment. The environment is, if they want to reduce their anxiety in the new environment, if they want to reduce their stressful condition in the new environment, but their success rate is very less. So though they are having some sort of trials, some efforts, but their success is very less because of their adaptive behavior, that is maladaptive behavior. So the productivity, the result is less, even though they have some sort of efforts to reduce their anxiety, stressful. Maladaptive behavior is an ineffective behavior used to cope with stress, anxiety and discomfort. They wanted to manage with the anxiety. If they want to manage their stressful condition, their discomfort they want to manage, but their success is very less. Ineffective behavior means their behavior is not effective. That is the reason they are not in a position to adjust with the situation. They are not in a position to adapt with the new situation or new environment. That is maladaptive behavior. Maladaptive behaviors are actions that prevent people from adapting. So these maladaptive behaviors are those behaviors, they prevent, they reduce the capabilities of the people to adapt. Adjusting or part, they want to adjust, but their efforts, but they are not in a position to adjust to the new situation, adapt to the new situation, then participating in the new different type of environment or situations. Yeah. So normal and abnormal. What is normal? What is abnormal? Normal means the norms we have in a society. There are some traditions, the systems. If you follow that norms, that means normal behavior. What are the expectations of the society? The normal expectation of society on any individual. If the individual is acting based on the normal expectation of society, that means normal behavior. If our behavior is normal, that means as per the expectations of the society, that means normal behavior. If our behavior is not up to the mark, not to the expectation of the society, that means abnormal behavior. So this maladaptive behavior, because of our not adjusting with the new situation, we are not in a position to adjust with the new environment. That means always we are away from the norms, from the systems of the society. That means maladaptive behavior in some cases leads continuous maladaptive behavior. If an individual shows continuous abnormal risk maladaptive behavior, which leads to the abnormality, means not up to the mark of the social expectations. There are some reasons, there are some factors of the maladjustment, or you can say maladaptive behavior. So is it clear? I explained what is adaptive behavior, what is maladaptive behavior. Adaptive behavior means the behavior which is having the capabilities of adjusting, adapting and mingle with other members in the new situation, new society, new environment. That means adjustable capabilities, adaptive capabilities. Even though if there is any unconstructive issues, unproductive issues, because of their adaptive behavior, they will convert, they will change the discomfort with the comfort. They will change the discomfort, the unproductive way, in a productive manner. Because of their maladaptive behavior, because of their adaptive behavior, they will understand how to behave in the society. They will understand how to respond to the society. They will understand how to respond to the individuals. So because of their social skills, because of their adaptable capabilities, because of their adjust capabilities, because they can adjust with the new situation, new environment. For example, if a person is having self-adjustment, automatically he will be in a position, or she will be in a position to adjust with the family members, group of people, society, peer group. So that means adjustable capabilities to the new environment, even the new situation also. In some cases, what happens if a person is not having that type of adjustable capabilities, adaptive capabilities, when he enter into the new situation, new environment, new group, he or she may not be in a position to mingle with effectively because of his adjustable capabilities are very low. That is the reason he is not in a position to adjust on their own self. He is also or she is also not in a position, may not be in a position to adjust with the group of people. So that is the maladaptive behavior, maladaptive behavior. The person having some maladaptive behavior, their adjusting capabilities, their mingling, their sociability is very low. What happens in this case? What happens in this individual? The same type of problem with adjustment, the same type of problem with adaptability, the same type of problem with the participating in different lifestyles or different aspects of life. The same thing is happening, the same thing is continuing forever. So what happened? This maladaptive behavior is frequently usually is an indicator of abnormality. So these maladaptive behaviors are the indicators of abnormality, or the continuous maladaptive behavior leads some sort of abnormal behavior. So what are the reasons for every aspect in the psychology? Maybe maladaptive behavior or any other issue related to the individual. There are some reasons, there are some causal factors. So what are the factors of this? And that is maladaptive behavior. There are some psychological factors, there are some other factors, but now in this class we will discuss the biological factors of this maladaptive behavior. In some cases, the reasons or the factors of the biological factors of the maladaptive behavior may be some hormonal imbalances. In some cases, hormonal imbalances may lead some sort of maladaptive behavior. Some sort of brain injury leads maladaptive behavior. In some cases, in some individuals, chemical deficiency that also leads some sort of abnormal, or you can say maladaptive behavior. So in some cases, brain injury, or you can say hormonal imbalances, or chemical imbalance or chemical deficiency that leads to maladaptive behavior or abnormal behavior. Some evidences are there that genetic factors also involved in maladaptive behavior and that is abnormal behavior. For example, anxiety, depression and schizophrenia. So this maladaptive behavior, some examples of maladaptive behavior means anxiety, depression and schizophrenia cases. The individuals having these type of stressful conditions, anxiety, depression and schizophrenia. So some reasons of this abnormal or maladaptive behavior, the reason is some sort of genetical factors. Genetical factors also one of the reasons of this maladaptive behavior. So chromosomal abnormalities, that is some chromosomal abnormalities like Down syndrome, Fragile X syndrome, Casio syndrome, Prader-Willi syndrome, Williams syndrome. These chromosomal abnormalities also some reasons of maladaptive behavior. So for example, brain. So biological factors, while explained biological factors, so brain functionings also, if the any functionings of brain is not up to the mark, so biological, that is indicators, or you can say biological reasons, as I mentioned, brain functionings or brain injury. For example, some cases of some individuals, there may be some accidents. In the accidents, maybe brain damage. Okay, in some individual, some children, some sort of issues like seizures, like fits. Because of their fits, seizures, some sort of brain abnormalities may be possible. So in the brain abnormalities, if the brain injury or other reasons of brain injury, maybe accidents, maybe some sort of issues in their childhood, that is age, childhood stage. So because of their brain injury, abnormalities in the brain, so this type of maladaptive behavior is possible. Structural and functional issues of brain. Structural means the structure format. Functioning, because of the structural abnormality, because of the structural issues, functioning issues may be delayed. So because of the structural issues leads to functioning issues, means they are not functioning in a proper way. These both structural and functional issues in the brain contribute to maladaptive behavior in the individuals. It leads some sort of maladaptive behavior in the ages. So in some sort of infections, injuries, toxins and other abnormalities in the brain leads to maladaptive behavior. As I mentioned, brain injuries, some accidents, some sort of major issues like seizures in the childhood or any other stages of individuals leads some brain functionings. That means brain structural or functioning issues leads, or you can say contribute to maladaptive behavior in individuals. Infections of injuries, toxins and other abnormalities also leads, and abnormalities of brain also leads some sort of abnormal, that is behavior, or you can say maladaptive behavior. Hydrocephalus. So hydrocephalus is a rare disability present in both that causes a central nervous system disorder. So the central nervous system impairs because of the hydrocephalus. When it occurs, the front hemisphere or cerebrum of a baby's brain are missing. In their place, the cerebral fluid, some sort of fluids in the brain, that is hydrocephalus. So the condition affects both male and female babies at equal rates. Some babies may be a higher risk of development, you can say, if either of the parents carries genes that are suspected for the causing of disorder. So these fluids, they will occupy the actual brain part. That is the reason of these fluids to some sort of abnormalities. So the hydrocephalus in the children, maybe any individual, leads some sort of maladaptive behavior. Then other reasons of that is maladaptive behavior, prenatal factors. So we know there are three important factors: prenatal, natal and postnatal issues. Prenatal issues mean, so prenatal factors related to mother's health condition during pregnancy leads to maladaptive behavior. That is, in the pregnancy, as you know, prenatal period is how many? It is 280 days, 9 months, 10 days time. During this prenatal time, during this prenatal period, prenatal means that is pregnancy time, around 9 months, 10 days, or you can say 280 days. In this prenatal factors, mother's health condition during pregnancy leads, if the condition of the mother's health condition of the mothers is not up to the mark. For example, if she is if she admitted in any hospital as an inpatient for more than 2 weeks, for example, if your mother, those are having pregnancy, if she admits in a hospital as an inpatient more than 2 weeks, as an inpatient means there is a major health condition. So if these major health issues of the mother during pregnancy leads some type of abnormality or maladaptive behavior. So the mother's health condition means physical health condition leads maladaptive behavior. That is one important factor, prenatal factor. Second is prenatal factor related to mother's stressful condition also during pregnancy. That also leads some maladaptive behavior to the children. Then mother's lifestyle and habits of some sort of drugs, some sort of substances. Some mothers, they will have some sort of habits consuming drugs or any other substance. These type of habits, this type of lifestyle of the mother also leads some sort of maladaptive behavior in their children. Then trauma. There is a strong link between especially child trauma to maladaptive behavior. There are evidences of childhood experiences, the experience of the children during the childhood stage leads some sort of maladaptive behavior, or you can say abnormal behavior. So the children, those are having some sort of discomfort in the childhood, it is bitter experience in the childhood stage or initial stages, that leads some sort of maladaptive behavior. Then Other important factors of that is the maladaptive behavior is autism. Autism, there are children with autism spectrum disorder. Autism, this is briefly you can say autism. The full name of autism is autism spectrum disorder, ASD. Autism spectrum disorder may be likely display externalized maladaptive behavior. That means external maladaptive behavior. So children with autism spectrum disorder shows the maladaptive behaviors of aggression, restlessness and tantrums. Children with ASD means autism spectrum disorder behaviors having some sort of behavioral issues, or you can say maladaptive behaviors of self-harm, self-injurious, and they engage in the repetitive motor behavior. So the autism is one important childhood issues. So these autism also one of the reasons of one of the factors, one of the causes of maladaptive behavior. Their behavior is some sort of maladaptive, abnormal behavior type of autism. For example, self-injurious behavior, self-harm, repetitive behavior, repetitive motor mannerism, repetitive speech, repetitive behaviors, tantrums. Tantrums, you know, tantrums means they lay down for each and every aspect. They will take the things of others. They will throw the things, throwing things, hiding things, destructive things, destructive behavior, disturbing others, involving without permission, involving others activities, disturbing the others. These are all some sort of behaviors of the autism. As we know, you can easily identify the child of autism because they will show their behaviors externally. So you can easily identify this child is autistic case because of their behaviors, because of their maladaptive behaviors, because of their by observing, by seeing this type of children, you can easily understand this is a behavior, this is a maladaptive behavior because of the autism. So their behaviors like maladaptive behaviors you can easily understand because they show the aggressiveness, more aggressive. They can't adjust with the situation. They can't that is adapt to the situation, but because of their maladaptive behavior, they can't understand. They can't for new situation, for new people, for new environment, their adaptability is very low. So for this maladaptive behavior of the children, one reason is autism. Okay, so this shows external behaviors, maladaptive behaviors, abnormal behaviors of aggression, restlessness and tantrums, throwing things, taking things from others without their permission, disturbing others, destructive type of behavior, self-harm and repetitive behavior, repetitive mannerism. So motor mannerism. These are all some sort of maladaptive behaviors because of their autistic issues, or you can say autism spectrum disorder, or autism also one of the reasons of their maladaptive behavior. Then other syndromal issues like abnormalities, like chromosome abnormalities, Down syndrome. Down syndrome is a genetic condition where a person's born with the individual born with an extra copy of chromosome. That means 21st chromosome. That means that individual have a total number of 47 chromosomes instead of 46. So actually we have 23 pairs of chromosomes. Means 23 pairs of chromosomes. In this Down syndrome cases, instead of 2 chromosomes in the 21st pair, they will have one more chromosome. That means instead of 46 chromosomes in the individual, they will have one more chromosome. That means 47 chromosome. This Down syndrome also known as a trisomy. In 21st pair of chromosome, instead of 2 chromosomes, they will have 3 chromosomes. That is the reason this is known as a trisomy. Down syndrome also known as a trisomy. This trisomy, this Down syndrome also some important the Down syndrome also one of the reasons of maladaptive behavior. This extra copy of chromosome and this additional genetic material alters the course of human development, which leads to maladaptive behavior. This extra copy of chromosome in individual leads some type of maladaptive behavior. Down syndrome is the most common chromosomal disorder in humans and most common cause of intellectual disability. So because of this extra chromosome, so maladaptive behavior can observe in the individuals. This maladaptive behavior leads some sort of intellectual disability. This is the one important chromosomal abnormalities of the maladaptive behavior. This is also biological reasons of maladaptive behavior. Now, Fragile X syndrome. This is also one syndromal deficiency, or you can say chromosomal deficiency, chromosomal abnormality. This syndrome is an inherited genetic disorder that can cause intellectual or developmental disabilities as well as social and behavioral problems. As I mentioned, maladjustment means one of the important characteristics, important symptoms of maladjustment or maladaptive behavior means social functionings are not up to the mark. The social functionings are not, that is not normal. They can't adapt to the social situation. They can't adapt to the social race functionings. They can't adapt to the new situation, new environment. So this Fragile X syndrome also leads some developmental delays, developmental disabilities. What is a disability? What is a delay? If the age is within the age of 6 years, so you can't say disability. It is a developmental delay. You can't say developmental disabilities because we can't conclude he's a disabled child because of the age is very. For example, if the age of the child is 2 years or 3 years or 4 years, there is a possibilities of, there is a chance of make up their delays by doing some therapeutical procedures. So that is the reason within this particular age group you can't say it's a disability. Means you can't consider these people as a disabled people. Only delays you can say. So this Fragile X syndrome leads some sort of developmental delays or development disabilities as well as some social and behavioral problems, or means I can say maladjustable behavior. Okay. So then Fragile X syndrome can cause mild to severe intellectual and developmental disabilities. So there are some classifications of disabilities like severe intellectual disability, then mild intellectual disability, moderate intellectual disability. This Fragile X syndrome leads mild to severe, means mild intellectual disability, moderate intellectual disability, or severe intellectual disabilities. Okay, some people also experience social and behavioral problems because of this Fragile X syndrome. So Fragile X syndrome causes moderate intellectual disability in males and mild intellectual disability in females. As I mentioned, based on their IQ levels, based on their intellectual capabilities, individuals having some sort of disability, there are some categories of intellectual disabilities. For example, mild intellectual disability. If the IQ levels are between 50 to 69, that is known as a mild intellectual disability. If the IQ level is between 35 to 49, that is moderate intellectual disability. If the IQ level of any individual is below 35 and above 20, these are the severe intellectual disabled people. So here in this case of Fragile X syndrome, if the intellectual disability level is up to the mark, for example, as I mentioned, the normal, that is, there are some classifications of intellectual disability. 90 to 110 is the normal intellectual disability and normal intellectual capabilities. 90 to 110 is the normal intellectual capabilities, intelligence level of any individuals. If the IQ level is below 90 and above 70, you can say below normal, or you can say below average of intelligence. If the IQ level of any intelligence, any individuals are below 70 and above 50, these IQ levels is known as the mild intellectual disability. Means they are disabled people, intellectually disabled people. Okay, so their intellectual disability is between 35 to that is 49, they are moderate intellectual disability. If their intelligence capabilities are between 20 to 25, 20 to 35, that is a severe intellectual disability. The Fragile syndrome leads some sort of intellectual disability. Means some children having intellectual disability, that reason, the causes of maladaptive behavior means Fragile syndrome. Fragile syndrome leads some sort of maladaptive behavior. Especially the Fragile syndrome causes moderate intellectual disability. That means moderate maladaptive or intellectual disability in the males. This Fragile syndrome leads mild intellectual disability in female. As I mentioned, maladaptive behavior leads some sort of intellectual disabilities or abnormal behaviors. So based on, because of this Fragile syndrome, there may be chances of moderate intellectual disability within the males, mild intellectual disability in females. Then other abnormality, chromosomal abnormality, Kurzweil syndrome. Kurzweil syndrome is a rare genetic disorder that involves delayed physical and mental development. So when the child or the individual is having mental and physical development, slowly, maladjustment, or you can say maladaptive behavior, that leads to maladaptive behavior. It affects various parts of the body and it characterized by the loose force of skin, poor muscle and other problems. Further complications of this syndrome include the development of the malignant and non-malignant tumors, heart defects and abnormal heart muscle growth. So if the physical issues leads to some mental health issues, these physical issues lead some sort of behavioral issues, that means maladaptive behavior. So other chromosomal abnormalities, Prader-Willi syndrome. Prader-Willi syndrome is a lifelong genetic disorder. As I mentioned, the reason of the maladaptive behavior, some genetical reasons, or you can see some sort of brain injuries, some sort of reasons related to their abnormal, this chromosomal. So here Prader-Willi syndrome causes excessive hunger that creates obesity. That means which leads to maladaptive behavior. Because of their obesity, there is a chance of maladaptive behavior. So it involves distinctive physical features and intellectual impairment which leads to behavioral issues. So if the individual's physical issues or physical problems leads to psychological or intellectual problems, which means behavioral issues, or you can say maladaptive behaviors. Then Williams syndrome. So Williams syndrome is another important genetic disorder that affects many parts of the body. Facial features also impact on this particular underdevelopment, short nose, full chest. Williams syndrome characterizes development delay, usually mild intellectual disability. As I mentioned, the physical disabilities leads to psychological disabilities. These are physical features, physical characteristics. The problem of physical characteristics leads to some sort of behavioral issue. Those issues related to the maladaptive behavior. So maybe brain injury, reasons of prenatal reasons, maybe some sort of genetic reason, some sort of chromosomal abnormalities leads this type of maladaptive behavior. So as I mentioned, so these are all the various issues, these are all the various reasons, biological causal reasons of this maladaptive behavior. As I mentioned, adaptive behavior, maladaptive behavior. The reasons of maladaptive behavior, there are some biological causes like brain injuries, hormone imbalances, chemical deficiency leads to maladaptive behavior. Some sort of reasons related to some sort of autism, hydrocephalus, some sort of factors related to the prenatal factors, some sort of reasons related to the trauma, some reasons related to the autism, some sort of reasons related to the chromosomal abnormalities. These chromosomal abnormalities may be Down syndrome, Fragile syndrome, Kurzweil syndrome, Prader-Willi syndrome, Williams syndrome, and other syndromal deficiencies leads to. These syndromal deficiency may not be directly impact on the individuals, but the physical characteristics, physical disabilities, mental disabilities because of these syndromal, or you can say chromosomal abnormalities, leads some type of behavioral issues. That means maladaptive behaviors. These are the main biological reasons, biological factors of maladaptive behavior. So I think you are understood the topics today. So okay, thank you.